80% of women report pain at 8 to 12 weeks postpartum.
Yeah.
2 to 6 weeks after the supposed all clear.
Okay, we are live with Dr. Jill Krapf from the Center for Vulvovaginal Disorders. Thanks so much for coming on. Dr. Jill and I have known each other for a long time, worked with each other for a while, but she went away from the DC area and has come back in the last year or so. And I wanted to bring her on to talk hormones. So maybe if you wouldn't mind just kind of telling us a little bit about where you are, what you do, and how you got into hormones.
So I am a board certified obstetrician gynecologist, and I practiced general OBGYN for a number of years before specializing in female sexual pain disorders. So I started a center for female sexual health at a major institution in DC as I continued to practice general OBGYN in addition. And then my family basically relocated to Texas for my husband's military career. And then I was doing the same thing out there in San Antonio. And then I recently moved back and I decided to focus all my practice on female sexual pain disorders only. So I'm very active in research as well as clinical work in this area.
And you've been posting like crazy on hormones on Instagram, and I've been just eating it up. So thank you for doing that.
Well, thank you. Yes, it's been a great outlet for me. I was in academics for 8 years, and so I was in charge of teaching medical students obstetrics and gynecology. And so now I'm filtering all of that energy and expertise into Instagram to teach
I love
providers and patients. So it's been a great outlet for me. I've really enjoyed it, and I've gotten a great response.
Yeah, absolutely. I actually sent a patient yesterday. I'm like, go check out her Instagram.
It's funny, all of my patients who see me, they say, I follow you on Instagram.
I know.
Great, we don't have to counsel as much.
Right, exactly. It's like, if you want all my stuff on this is where we talk about that.
Exactly.
Awesome.
But it's great because we can focus on their specific individualized questions, which is always very nice.
Definitely. Cool. All right. Well, we have some questions. Kind of what we're trying to tie in is just hormones and postpartum and kind of some of the myths. So first of all, like, what are the most common postpartum hormone questions that you see from a new mom's perspective? And I want to add here too that you have 3 kids.
Yes.
So you know this professionally and personally, having gone through all of that as well.
I sure do. So this has really changed since I've transitioned from practicing as a general obstetrician gynecologist to a sexual pain specialist. So as a general OB, I would see women mainly for their 6-week postpartum visit. And the most common questions involving hormones really related to breastfeeding. And especially if they were struggling with breastfeeding, what could increase their milk supply and so forth. It was really rare to see them after that 6-week visit unless things were really not healing the way that they should. Right. So I would occasionally get questions regarding vaginal discomfort or concerns about how their tear was healing. And those questions would either come at the 6-week visit or then I would see them later for these concerns. But generally, as a general OBGYN, the advice would be, well, let's give it some more time. That was kind of the general go-to. It's changed now. So as a sexual pain specialist, I often see women who are a little further along in their postpartum and they're having vaginal dryness, pain with sex, sometimes related to breastfeeding. But these are the patients that I'm generally seeing now.
Mm-hmm. And with breastfeeding, with the hormone flux and so on, how long after you stop breastfeeding would a mom necessarily be concerned about hormone levels, or when should things kind of settle out?
Absolutely. Well, the first thing to consider is when's the high time for these symptoms with breastfeeding, and it's not often immediately. We usually see the most dryness and pain with sex symptoms at between 3 to 6 months, which may surprise you. You may think that's a little bit late, but actually that's the time when I often see patients who have these concerns. And then as far as things hormones kind of going back to a pre-pregnancy or a pre-breastfeeding state, it really does take a while. It's not an automatic switch once someone stops breastfeeding. These levels really slowly decline back to normal states or raise to normal states. And it can take up to a year, or it can even take longer. And it really depends how long someone breastfeeds, the duration of breastfeeding, many different factors involved.
Gotcha. And you do a lot. I'm thinking here with birth control, and I know that's one of the first things on that postpartum visit. They're talking about getting moms on birth control. Can that help? Can that hurt?
It depends on the type of birth control. When you're talking about a progestin-only option, that tends not to increase sex hormone binding globulin. Sex hormone binding globulin is the protein that really decreases the amount of androgens. And so those people do a little bit better. But if someone goes onto a combined birth control pill, we can sometimes see effects from that too.
That's good to know. I think that's especially when you're in this weird spot between your kids are, not toddlers anymore, and you haven't quite hit the peri-menopause train yet. Like, you're still trying to figure out, I'm done with the postpartum hormones, but what's going on, and where's birth control and all this and so on.
It's true. And peri-menopause lasts for a very long time. I mean, it can be a full, 10 years before you hit menopause. And I think a lot of women aren't really aware of all the subtle changes that occur in perimenopause that they may be attributing to other things that really could be related to that steady decrease in the hormones that naturally occurs.
Yeah, that's definitely, I think, a phase I'm starting to see another level of women, because they might not have had issues or symptoms with leakage or prolapse or anything postpartum. They thought, whoop, I'm totally clear. And then they're at Soul Cycle one day or something like that, and they hop up off the saddle, and all of a sudden they have leakage. They have no idea why. And for me, the first thing I'm thinking is, oh, perimenopause, we've got some hormone changes in those local tissues. That it's like that first tip of the iceberg, that you might have all this stuff going on underneath. So you'll know when my content switches, when I'm, much more in perimenopause myself.
It's funny how it reflects where we are in our lives.
It does, doesn't it? Like, my kids are 9 and 7. I'm like, postpartum it keeps going. But those babies, people think we're old when we have a 9-year-old. So. All right, relaxin, and kind of piggybacking on that, like, I think relaxin gets so thrown under the bus as the only thing. And you mentioned, estrogen, testosterone, progesterone. Like, what are the myths, and where should we really kind of be turning our attention as far as other hormones are concerned?
So this relates to all of that. I think the most common myth is that women are cleared for intercourse at 6 weeks postpartum. I think this is actually a damaging myth, right? Up to 80% of women report pain at 8 to 12 weeks postpartum.
Yeah.
2 to 6 weeks after the supposed all clear. So I think we really need to really set up our true expectations for this. Up to a quarter of women will have pain up to 6 months postpartum. So when we frame it this way, it really gives us, a little less pressure on ourselves, and also to know when it's good to see a provider to figure out what may be going on. It's often related to hormonal effects related to breastfeeding, not always, but often. And I think what women really need to know is there are so many great lubricants and moisturizers and even low dose topical local hormones that can really be helpful. And there's a little bit of fear around that, and I don't think that there should be.
Yeah, and I think that brings up a really great point. Depending on, I think if it's your first, second, third, in the beginning, all of it's so important. Getting back to sex, getting back to workouts, all of that. By the time you get to kid number 2 and 3, I think you can push off the sex a little bit longer. But we want to get back to those workouts. So if we've got changes that are affecting sex and whatnot, and they go on that long, we've probably got those hormones that are affecting other things as well. So again, to your point, we're barely cleared at that point, but we can have issues much further beyond and have it still be within the realm of normal, but definitely need somebody to check it out for sure. So
Yes, and it's really about doing things that are going to make you feel whole again, and really doing things that are good for yourself, because then you'll be able to take care of your baby and your family in a much better place. And that's where intimacy comes in, and that's where exercise comes in. There should never be pressure for these things. These things should be looked at as a component of your personhood and your self-care.
yeah, I've been doing a lot of kind of polling on social media, and the biggest issue quite often is that comparison trap and the mom guilt and these bigger issues that they end up demonstrating themselves and like over exercising or under, feeling guilty because you're not out there working out and so on. And I think, to your point, like, these are part of who we are. So it's very important to make sure that you do the things that you need to do to make sure that you can find those outlets. All right, one last question. So when a mom is breastfeeding, they're trying to get back to workouts, little sleep, maybe they're not doing fun things like having sex. What are possible concerns from a hormone perspective?
So again, just to reinforce, I think the most important message here is don't put too much pressure on yourself. It's really difficult adjusting to a new human, not sleeping, the lack of routine, and really the lack of time to re-energize yourself. So really don't think of exercise as something on the to-do list or create unrealistic exercise targets. And same with intimacy. You don't want to put that on a to-do list or really put a lot of pressure on yourself saying that it's going to ruin your relationship. Right. Exercise and sex should be something that you do to re-energize yourself and to make yourself whole. And so, I think when it comes to exercise, especially for breastfeeding, the biggest thing is you want to make sure that you're drinking enough water, yeah, and that you're taking in enough calories. Yeah. If there's really rapid weight loss, which often happens after delivery, especially if you're breastfeeding and you resume a workout routine, that can have detrimental effects on your milk supply. So you want to make sure that everything is gradual, so your body gets used to the new state.
Exactly. Yeah, I'm going to have somebody come on and talk about Redd's syndrome, where over exercising, you're trying to lose the baby weight, you're not eating enough to handle the breastfeeding and that sort of thing. And I don't know that moms necessarily realize that you can end up with, stress fractures and things like that aren't good. So I think the more information we can get out about nutrition, sleep, the things that are going to help you get through this period of time and keep you whole, like you said, are very much where we need to have a little bit more emphasis, as opposed to the comparison game of who's doing what by 6 weeks on Instagram. So
absolutely.
Awesome. All right. So if you want to know a little bit more from Dr. Jill, you can find her on Instagram at Jill Krapf MD. And you're also working on a website, yeah?
Yes, so I did launch it. It's www.jillkrafmd.com. And what I'm trying to do is I'm trying to take my Instagram posts, which are basically educational mini blogs, and put them into actual blogs, awesome. Same length, but it makes it searchable, so you can really find what you're looking for, which I think is a benefit of having it in blog format instead of on social media. And then you can also find me at the Center for Vulvovaginal Disorders in Washington, D.C., and you can learn more at www.cvvd.org or vaginismus.com, and we have a lot of great information on our website as far as education goes, as well as full text articles for any patients or providers out there that really want to dive deep into any subject.
Awesome. So if you want to know hormones, if you want to know vaginal pain, you definitely want to follow Dr. Jill. So thank you so much for putting that information out. And you're also an amazing voice for women and moms in medicine, and I want to thank you for doing that as well. So thanks. All right. Have a great rest of your day. Thanks for being on.
Thank you.